All right, folks, I'm really excited today to learn about a brand new program that's out there called the Dementia Care Family Support Program. And we have some of the team members involved and users involved today. So before we learn about this program, let's meet who we've got on the screen with us. And Denise, I'm going to start with you. Tell us a little bit about yourself and your role in this program.
Hi, Steve. It's so great to see you. Thank you for having us with you today. I'm Denise Brown, and I started supporting family caregivers in 1990. And I launched a training program called a Certified Caregiving Consultant program to help professionals coach family caregivers. And we integrated that program into this dementia care family support program. And it's been fabulous. I also am a former family caregiver. I helped my dad for almost 20 years, and I helped my mom for just about 8.
I love it. And now, Annmarie, I have known you, like Denise, for many years. You're an aging life care manager. And tell me a little bit about yourself and your role with this program.
Thanks, Steve. It's great to be here. I am a family life care manager. I work in the Baltimore area of Maryland. I have also been a family caregiver and have been involved in serving older adults for many years in different capacities professionally. This past year, I learned about the Plans for Care and the Dementia Care Family Support Program through Denise and the Certified Caregiving Consultant program. All came together. I was part of the pilot program and am thrilled to see it moving forward as an offering to the community.
I love it, and I'm really glad that we're going to have your perspective as a user of this program. I think that will make this discussion really interesting and authentic. And Eric, I have enjoyed getting to know you recently, but tell us a little bit about your background and your role with the program.
Yeah. Hey, Steve. Great to be here. Eric Jutkowitz. I'm actually a researcher by training. I am on the faculty of the University of Minnesota School of Public Health. My research is focused on understanding the long-term care system. Um, 3 years ago, I co-founded a company called Plans for Care with two other researchers that I've been working with for a number of years, Laura Gitt and Kathy Pearsall. And the goal of Plans for Care is to take essentially our learnings from the trials that we've conducted in supporting caregivers and packaging it in a way that can be more accessible to folks. And so we'll talk a little bit more about how Plans for Care was used in the program itself, but really excited to be here, really excited to have Denise and Annmarie as collaborators, and it's been a lot of fun.
I love it. Well, let's dive into the question that I and many people will probably have is, what the heck is the Dementia Care Family Support Program? I'll let any or all of you comment on that.
Yeah, I can jump in. We really looked at how do we support family caregivers with personalized care plans, and that's plans for care and coaching. What we wanted to do was equip our CCCs, the Certified Caregiving Consultants, with technology that they could then use to personalize and tailor suggestions that family caregivers of persons with dementia could integrate into their day. We think about the big question that both coaches and family caregivers have, which is how much do I do for my caree? When do I step in and help? And with this program, we can give guidance based on the technology as well as our conversations with the family caregiver to really help them feel like, okay, I know what my caree needs help with, and I know when I can step back and it's okay. We really learned so much in the pilot program. We had 17 family caregivers that went through the pilot program with us. We had 5 CCCs, including myself. And we ended up, and Eric, you'll correct me if I'm wrong, we ended up delivering something like over 100 different coaching sessions. And the average time spent between client and coach was an hour. And we really thought when we were launching the pilot program that each session would be about 30 minutes. But what we realized, and I know this, It was so awesome that the data showed this to be true, that family caregivers really want to have a conversation about the reality of their day. And what the CCCs do is step into the day to really learn what it's like for that family caregiver, because it's different for everyone. So in that conversation, they really gain such helpful insights that then helps package our suggested care plans. And that really was the power of the program.
Excellent.
Yeah,
All right.
I mean, to me, one of the key learnings of this is the power of the human connection through the CCCs, but enhancing that connection with software that sort of supports the CCCs and gives them the foundation to have like a structured, semi-structured, essentially, and meaningful conversation. So, to me, one of the main questions from a research side of things is, and I think a lot of people have this, like, to what extent can technology either replace or complement humans in a number of different fields, in this case, caregiver support, sort of the healthcare space. And one of, again, the key learnings is that at least the technology we tested can't really replace humans, but can extend them and enhance their sort of capacity and power to sort of create a multiplier effect, which is really nice to see.
Wow. Okay. And Annmarie, as and as a user of this program and part of the pilot program, tell me a little bit about your experience in using this. And I don't know if it's fair to sort of contrast before the dementia family support program and after. But I'd be curious at all of your all's insights on how you're working with a family without this program and then now having experienced it.
So I think the beautiful thing is having this tool on top of the relationship. So the relationship's always important. Getting to know the caregiver, um, getting to know their world, their life, their culture. So there were a couple carries that culturally were different, and so really trying to find how we could meet their needs. But having the program on top of that was an immediate resource. So sometimes we're talking about the day to day. It may be something the caregiver is struggling with personally. It may be something that the caree is struggling with, a behavior, an emotion, something we're trying to figure out. And the plans for care allows you to get right into it. And you're pulling together the resources of lots of brains that are in that system to be able to have suggestions and resources. Um, because everyone's different, we tend to have those typical suggestions we go to, but not everyone's the same. So having those other suggestions right at our fingertips is really pretty amazing.
Wow. Well, Eric, I mean, you, I guess, you've got the more global view of how this is, what they're utilizing the program for. Can you share any insights on that?
Yeah, so just to be first concrete, I think about what the software is and how it's being used. The software has what we call a measure of everyday function. And so it's a tool that was used by the CCCs, administered to a family caregiver. And what it does is it differentiates between 8 different levels of abilities for the carrier, the person with dementia, from the very early stages of cognitive impairment, dementia, to the very end stages, and then everywhere in between. And that by itself was really powerful in that that serves as its own sort of delivery mechanisms. And it's a point of sort of level setting with the caregivers about what is actually the ability of the person they're caring for. And when we looked at the data, we actually saw that there was like a nice bell curve, if you will, of the distribution of carries. And it was sort of centered on sort of that middle moderate stage of dementia. But there were people on the far end of the tails, which were sort of the end stages and the early stages of the disease. But most people were sort of in that middle level. The second piece of the software that the CCCs were able to use was a database of more than 80 caregiver related challenges. And so, in conversation with caregivers, the CCCs would kind of understand what are their top challenges. They then sort of translate what the caregiver said a top challenge was and find it in the database. And from that, they were able to build out a personalized care plan. And what's really important for the personalization of the care plan is the information that goes on that care plan is specific to that care challenge and also specific to the level of everyday functioning. And so even though a caregiver, two caregivers could say their challenge is my mom is agitated or my mom's aggressive, they can have very different action plans or care plans based on their level of everyday functioning. When we looked at the top, I think we looked at the top 10 care challenges that were recorded by the CCCs and delivered in care plans. 5 of the top 10 were dementia-related behaviors. So things like agitation, aggression, resisting care. I think wandering was on that list as well. So 5 of the top 10 are these dementia-related behaviors, and that kind of tracks with what we see at like a more macro level in research and in the sort of scientific literature. The other sort of 5 challenges that made out that top 10 were things I believe around activities of daily living, like how to support your carry with dressing, bathing, eating, as well as more caregiver-centered concerns like how do I find time for myself or how do I manage my own stress?
Wow, this is great. Now, I understand, did you all were, I believe, partnered with ASA or did a
Oh,
program with ASA?
that's
Um,
right. Yes.
if you'd like to share a little bit about that, and any insights that you gained through that partnership.
So Eric and I presented at ASA's American Society on Aging's annual conference in April, and we were able to present the results of our pilot program as well as a case study. The pilot program was organized to provide 5 sessions to resolve 3 care challenges. And what we found is just about half of the family caregivers that participated in the pilot program continued on with their coach because they saw so much value. We presented a case study, which I can tell you about now, around one of those pilot program participants and happened to be someone who worked with me and continues to work with me. So it's Virginia, and she actually just turned 93, and she cares for her husband, Ed, who is 92. And in our first session, it was Virginia and one of her adult daughters. And we went through the everyday function scale. And Ed, who we call ASA in this particular example, fell on the spectrum, which is D, so towards the lower functional level. And what's interesting is when you realize where someone's functional ability is, you also gain insights into concerns. So, for instance, where Ed was indicated that he will not notice or react to unsafe situations, like a smoke detector alarm. And when we realized that in the first session, we immediately went into family emergency planning. Virginia started wearing a watch, a personal emergency response. One of the other adult daughters added a camera inside the home. And then the adult children started working within the community where Virginia lived to take a tour of memory care, to learn about home care, and to learn about home health so that they had insights in case something happened to Virginia or something happened to Ed. That was really powerful. By the third session, we had another adult daughter join us. And by the fourth, we had a third adult daughter join us. So there were 4 of us, and we continued to meet regularly as a group. And it's been really helpful because Virginia has been able to express honestly with her adult children about her concerns. For instance, during our very first meeting, she said to me, I'm not going to lie to my husband. People tell me all the time to just lie, just fib. She said, I am not doing that. I said, okay. So anytime I suggested a solution or a potential strategy, I always checked in. How truthful does this sound to you? I know that being honest with Ed is very important to you. That was really helpful for her to just say upfront, this is what's going to work for me, and this isn't going to work for me. Just recently, she asked, what's next for us? And we had a really honest conversation about what declines look like. So they live in their own home in an independent living section of a community. And we talked about when mobility issues start and you have to bring in equipment and you have to bring in more help, what that does inside the home, and then what it could do for Virginia. And we really talked about as he declines, she'll help more, which is why we're really looking at how to help her more. We also had a really interesting conversation where she said, sometimes I just feel like I can't keep doing this. I just wonder how much longer. And we spent about an hour really thinking through strategies around how to help her and support her. And that honest conversation has actually been so helpful for her relationships with her adult children. And as a result of us meeting together, they now meet without me, which is awesome as a family, just to socialize and catch up and share updates. So Virginia, who's 93, joins via Zoom, which is awesome. So she's very used to technology. She loves the ability to connect with her adult children who don't live near her, but it's been very important to her to stay engaged in the relationships. So when I think about what's been so helpful about the program, it's these almost like facts about a disease that is so hard to actually rationalize. And then it's also about connecting to someone consistently who is just there to hear, to suggest, and to understand. And then in Virginia's case, it really is about the relationships with her adult children, which has really been, I mean, I have goosebumps, honestly, thinking about it, which has really been so powerful.
Hmm. No, this is great. And I can see where the coaching and the relationship between you and bringing their family together, the value of that and the value of having an aging life care manager, a CCC, and that coaching, help me understand where you lean on the software, and where that becomes a resource to help you with the plan.
And
Okay.
Denise, I am sharing, I don't know if you can see, but I am sharing the care plan that we had up.
Yes,
So
yes.
Yeah.
So with what's so great about Plans for Care is when we go into the database and pull out strategies, I can actually select which strategy is most important. So Virginia, I made sure never to select a strategy that talked about just telling a little bit of a fib. And what then I could send to Virginia and her adult children was the actual care plan, but every care plan included the everyday function scale. And here's what I think is so fabulous about this. It's just a reorientation tool every day because you wake up and you think, wait, what has happened? It's just so hard to stay oriented to a disease progression. Oh, and this reminds you, okay, this is what, for instance, Ed can do. This is where he is. And it's again factual. It takes out the emotions that we feel. So it's helpful to just read about it. Okay, this is where he is. Okay, based on where he is, these are the strategies I could look at that can help. It's very easy to digest. And in a complicated, complex situation like caring for a family member with dementia, we want something that just feels like, okay, I can read this, I can understand it, and even more so, I can implement it. I can try
Hmm.
this. So, for instance, with Virginia, when we first started connecting, she hadn't been able to give Ed a shower. And when we were in our fifth session, we went through suggestions and guidance, and I was able to send her what the suggestions and guidance are from Plans for Care. So it was really helpful strategy. So we talked it out and then she could read it and refer to this. And when we connected for the sixth session, halfway through the sixth session, she said, "Oh, I forgot to tell you guys, Ed took a shower the other day." I said, "Virginia, you're bearing the lead. Like, that's where you want to start. Like, that's awesome. That's awesome." It was huge for her to feel like I'm empowered to be successful in providing care. And that is peace of mind right there.
I love it. And the other thing is, as challenging and stressful as it is to be a caregiver and living with dementia is obviously challenging, but being an advisor, a coach, a care manager, a CCC is challenging too. Annmarie, have you found that utilizing this sort of holistic approach with the coaching and the software, blending that together to improve and help you deliver better support to your clients?
Yeah, because I've got a bunch of resources right at my fingertips. So the relationship building we're going to be doing with everyone, but because each carry is a little different, you just don't know which tools in the toolbox you're going to need and what may change. It could change from the beginning of your relationship or as you move through. Or you may have tried something at one point and it didn't work, and as you're working through other things, you realize, oh, let's go back to that other tool and see if that works.
Well, what I really like about this approach too is that um, we all see, advertisements and promotion for apps and things of that nature that are sort of a do-it-yourself type thing. And I love it when we can blend the personal coaching with the technology. And I feel like this is something that this program is doing really well.
So
Um,
Steve, you asked about ASA. I have to talk about the numbers for a second because I'm the researcher. So the other thing we talked about or presented at ASA was changes in outcomes before versus after people participated in the program. So like a pre-post design. Our sort of key outcomes were related around stress and quality of life, and all the measures move in a direction of improvement from after compared to before. So when we asked caregivers about their own stress, it decreased. When we asked caregivers to rate their perceived stress of the person they're caring for, it decreased. We asked caregivers about their quality of life, the quality of life of their caregiver. It improved from before to after. And when we ask caregivers, it's a measure called perceived change. It sort of has 12 items, 12 or 13 items, and it has the items are around like caregiver confidence, caregiver ability to cope, caregiver mastery of skills. That improved from before to after. So um, we're hearing like all these great, the qualitative sort of data stories and data, but it's all supported also by, the quantitative data as well. So it's sort of a nice story that's coming together.
I
And
love it.
I want to add that that comparison happened within about 4 weeks.
Yeah.
Mhm. So it was quick. We were able to really show a quick improvement within a family caregiver's experience.
Man, this is real exciting stuff because I mean, uh, my heart breaks on a weekly basis when I'm talking to families that are um, helping their loved ones with dementia, and lately been talking to a lot of people that are living with dementia alone as solo agers, and you can see where the support of and being involved with this program with the CCC with an aging life care manager and this program would be wonderful. Um,
And Steve, I've used it with someone living with dementia as well. And
oh
yeah,
wow,
so the solo ager living with dementia can really benefit from this program as well. It's a different approach from us since there's not a caregiver in the middle, but it's still very effective. Lots of good information.
I love it. All right, so how can people or professionals get involved with this program? L- Let me know that, and I'll make sure to have all the links in the show notes.
So since the pilot program was successful, we've actually launched it as a program for any family caregiver caring for someone with cognitive impairment. It's budget friendly. So we work with any budget, including offering scholarships. And you can go to our community, which is caringourway.com, and look for information about our dementia family care support program. You can also reach out to me through the community, and I'm happy to actually connect you to a consultant or someone like Annmarie who can support you as you care for a family member. And what am I forgetting? Eric? Oh, Eric. Yeah, you should talk about how people can connect with you.
Yeah, well, the other important thing before I talk about connecting with myself, the other important thing about what Denise mentioned is all of the CCCs and professionals that are listed on essentially that portal, they're all powered by the Plans for Care software. So they have that as a tool and resource to guide their work, which is important. For folks, for professionals like Annmarie, Denise, other care managers, OTs, social workers, folks in residential staff in residential communities who are interested in having plans for care support their team, they can reach out directly to me. My email is Eric_Jutkowitz at plansforcare.com. Steve, we'll give you the link to that so people don't get the last name spelling messed up. Um, but yeah, please reach out. We'd love to have a conversation and talk about how we can empower your staff with the tools.
And I
I
just want
love
to
this.
mention for anyone who is a former family caregiver thinking about, oh my gosh, could I actually be something like a coach for family caregivers? Yes, you can. And you can enroll in our Certified Caregiving Consultant program, which is really all about transforming your personal caregiving experience. And we've integrated training on plans for care in the program. So when you become a CCC, you have plans for care that you can start to use with clients.
I love this, and so many people come out of the caregiving experience
Mhm.
and with so many insights and so many blind spots that they didn't know about. They seem very compelled to figure out how can I help others now that I've done this. So I love the fact that you got that program, Denise, and this is amazing. Well, I, I think we've covered a lot, although I think I'd love to schedule another one of these discussions. But is there anything for this one today that you haven't had the opportunity to share that you'd like to share? It sounds like we covered all bases
I
then.
think we did. Yes.
Well, I want to thank y'all for your time. I'm delighted that you're out there making the world a better place for people with dementia and their loved ones, and making the lives better for professionals because with the way things are going as professionals, we may need to carry bigger caseloads because there's just not enough resources out there for folks, and tools like this and programs like this really make it better. So I can't wait to chat with you and hear where this program goes in the future. And folks, I hope y'all sign up and inquire about it. Thanks a lot.
Thanks,
Thank you,
Steve.
Steve.